Get more information about Eklavya Foundation. I have written all this information in the chat box. A few instructions to everyone. Please mute your videos and please mute yourself and turn off your videos if you are moving. Second is we'll be recording this session for the so that we can upload this session on our YouTube channel. Now I will give control to Ganesh Rajan, who is our coordinator for self-help support group, and he's a member of Eklavya Foundation for Mental Health. So over to you, Ganesh ji. Thank you.
Thank you, Manjiri. Thank you very much. I'm Ganesh. I am a mental health volunteer at Eklavya Foundation. It is my privilege and honor to introduce Dr. Mohan Raj once again as a guest speaker for today. Dr. Mohan Raj is a consultant psychiatrist based in Chennai. He has a consulting practice in Chennai for over 2.5 decades. An MBBS student from Stanley Medical College, Chennai. He is an MD in psychiatry and a DNB from NIMHANS, Bangalore. Among his honors are the Jairam Award for the best research paper and the PV Subramaniam Gold Medal for proficiency in psychiatry. Dr. Mohan has delivered many educational lectures and workshops in venues such as schools and corporations. He has offered mental health awareness programs through print, radio, TV, and the web. He has also been featured prominently in several newspapers and has written articles for several publications. Since February 2022, he published videos regularly on YouTube on mental health awareness. These videos are available in the channels Mindscape Matters in English and Mananalam Nalamaria Aval in Tamil. We look forward to his insights on a matter that plagued many of us, drug addiction. Please note, we will be recording Dr. Mohan's talk today. A warm welcome to Dr. Mohan and all of you present. Over to you, Doctor.
Yeah, thank you, Ganesh, for the kind words. Is there any echo?
No, it's okay.
Good evening, everybody. I thank Eklavya Foundation and Mr. Ganesh and Manjari for organizing this. And it's great to be with all of you again. The initial part shouldn't be missed. So are there more people expected to join or we keep going?
नाहीये मला वाटतं आपण काही दिसत नाही.
Yeah, can everybody mute?
Doctor? Yeah. Yes. Generally we hit around 60, but I think we will go, given the time constraint, we'll just get started, sir.
Yeah. People are coming continuously. Yeah. Okay. Good evening, all of you. Ganesh mentioned drug addiction. In a way, it's like a drug, even if it was a slip of tongue. I think it's a drug. We straight away, today I have organized in such a way, what does digital addiction mean and why digital detox, and then look at some of the consequences and some of the methods by which. It's not very comprehensive. There's a lot of work going on, but I'm just going to give you a bird's eye view of what is happening. So why digital detox? Why is this topic important? You must have read a lot, or you must have been seeing a lot about this of late. Now, I just want to ask all of you some questions. Please open your chat box and you can answer yes for why, no for no. Okay. All of you, I want you to interact here. Have you ever felt the need to cut down your internet use? At least one or two, keep your video on, Ganesh, so that I know, okay, I'm talking to somebody. Can you all respond to this? Have you felt the need to cut down your internet use? You can use the chat down and say Y or N. I don't get any answer. Oh, chat is there. Sorry, I didn't see the chat. Okay, lot of yeses, lot of yeses. Next question is, one second. Is it not? No, my file is not moving. Let me just figure it out. Yeah. Have people annoyed you by criticizing your internet use? You can say yes or no. Next is, have you felt guilty about your time on the internet? Like, I wanted to spend 15 minutes, I ended up spending 2 hours, I'm feeling very guilty about it. Yeah, some no, but many yes. Many no. I have to meet all these people who said no. Now the next thing is, when the chat is open, my slide is not moving. Yeah. Have you ever felt the need to check your updates first thing in the morning? You get up, even before you brush or go to the toilet, do you pick up your phone and you need to check the updates on either WhatsApp or one of the social media? Some yes, some no. A lot of people know. Why am I talking to this audience? Okay. Now you might be wondering where I got these questions from. This is from a questionnaire called Cage Questionnaire. One second, some problem with my slide not moving. Okay. There is something called Cage Questionnaire for alcohol. C standing for cutting down. Have you felt like cutting down your alcohol use? A is, have you been annoyed when people talk about your alcohol use? Guilt about your alcohol. And first thing in the morning, you have tremors and you take alcohol. I just stole it, flipped it, and asked the question about internet. And many times people say, yes, they have all this. Now, for copyright reason, people haven't used this. They have a separate questionnaire. I'll just ask you a few more questions. Do you sometimes use your smartphone when people are talking to you? Somebody's talking to you, but you lift the smartphone and look at it. Now, one of the common complaint about doctors nowadays is patients talk to them, but they pick up their mobile and the patient stops, but the doctor says, no, go on, go on. I am listening, I'm listening. That's a common complaint nowadays. Do you break off conversation to check your smartphone immediately when a new notification comes in? You're talking to somebody, suddenly you stop and you start looking at the messages. I'm just going through the message here, a lot of no's. One second, no problem. Yeah. Do you check your phone while watching a movie? Movie is going on, but you'll slowly pick up your phone in between, keep looking at it. I have to keep going back to the chat and seeing, because if the chat is on, my slides are not moving. So I'll go and have a look at it. No. Lot of no's. Some yes, so it's worth continuing the. If it's a lot of no, I can finish off the talk now itself, Ganesh. Yeah, I think the chat is open. My slides are not. One second, sorry. Slow there. Some problem. Can I just come out of the.
Doctor, why don't we go on and take the poll results. We'll
Yeah,
request.
later, yeah. No, my slides are not moving, so that's why.
You're not screen sharing. You'll have to reshare your screen.
I'm going back and sharing again. This time, I think I won't wait for. I'll look at the
Yeah.
poll. I will have a look at it later.
Okay.
Yeah. Do you take your phone to the bathroom with you? I'll see the results later. Let me not keep going back. Okay. Now, is there something called internet addiction? Some of you can unmute and say. Okay, I'll
Yes,
give
yes,
100%.
my
Okay.
son is addicted to the mobile phone
Yeah.
and to the
See,
internet.
See, what has happened is we haven't still included in the diagnostic systems. We don't have a diagnosis code and all that for insurance claims everywhere, anywhere in the world. It is mentioned as a condition of interest, but it's not come as a diagnosis. But that hasn't prevented families from seeking our help, parents bringing their children, or spouses bringing spouses or other family members because of excessive internet use, and we have to deal with them whether it's official diagnosis or not. I want to tell you historically 3 points. 1995 is when internet became available for wider use. Before that it was primarily in labs, universities, but 95 it came to India also. And what happened at that time was excessive usage, gaming. There were children who were going to this internet parlor, staying all night, playing games, and like this was all in 95 to early 2000. So there was this talk about internet addiction, everybody grounded all the time with the computer all the time. Now, at that point, your access to internet was only through computers and you had to be at one place. Now, 2007, the first smartphone came. 95, 96 phones came, and slowly the phones became smarter, and smartphones came from 2006, couple of brands, then 2007 iPhone. And then what has happened is now you don't have to sit in a place to access the computer. You can access internet from anywhere. Wherever you go, the computer is going with you in the pocket. And now the picture is more like this, that wherever you go, it's grown on you and it's with you all the time. Now, the third point in history is 2023-24, where AI has come. And AI is as if somebody is talking to you about something you want to check, whether it's ChatGPT or there are a lot of apps where AI is inbuilt, where it gives you feedback in a very conversational tone and sentence structure. And it's feel as if somebody is gone through your 1 month of data. Like, for example, exercise app has a AI feature which talks about your relative effort in the last 1 month and gives you sentences very encouraging as if somebody is talking to you. In fact, there is a movie where somebody has an AI girlfriend and at some point he realizes she's not real. So we don't know how much AI is going to disrupt, how much that is going to cause people to get hooked on. We will know in the next 3-4 years. Now, as of now, it's the mobile, which is a major source of addiction. And I don't have to convince all of you that it exists. That I'll probably tell you the symptoms or what are the features of internet addiction. One is salience, that becomes the most important thing for them. That internet and the mobile it's not just the mobile. The internet through mobile becomes the most salient thing in their life. And there is mood modification. Every time they get a ping or there is a notification, they get a surge in their mood. It's because they have studied, there is a dopamine bump. Now, dopamine bumps can happen when you listen to good music, when you go for a walk, run, or you do something which you really love doing. Similarly, now the apps also, when the notification comes, the buzz comes, some people get a bump and they like it. And then tolerance is a word we use in alcohol, where you are okay with 2 pecks, you feel great. After 6 months, that's not enough. You need to take 3 to have the same effect. Same after some time, 3 becomes 4. Same thing happens with internet usage. Initially, you are okay with less amount. Then gradually, you need to take more and more. And when the person cannot access internet, they have withdrawal symptoms. They feel irritable, they feel uneasy. Suppose the Wi-Fi is not working, the network is not working, they become very, very disturbed. So these are some of the symptoms. And what are they addicted to? The people whom we see constantly, youngsters, mostly are addicted to games. They play games for hours together in the night, and in the morning, they're not able to go to school. Another group of people are addicted to social media, like social media in terms of Facebook, or youngsters are mostly addicted to Instagram. And there are people who want to project as intellectuals, they are addicted to Twitter. There are a number of social medias where, according to your personality, like if you feel you are beautiful, then your go-to place is Instagram. If you think you are smart, intelligent, then your go-to space is Twitter. And then there are people who are addicted to mindless watching reels and shorts. And the reels and shorts, by definition, should be less than 1 minute. And this is causing a lot of problem to attention span. I'll talk about it a little later again. Then there are people who are mindlessly watching news. Like today, all of you would have tuned into news to watch what happened to Trump versus Kamala, and that is fine. But there are people who go every day, every news they will read at 10 different outlets, different views about the news. What else are they addicted to? People coming to us, some of them are addicted to gambling, and earlier gambling you had to go to a physical place. Now it can be done right from your home. Some of them are addicted to stock trading. Now this is like independent of internet. They were doing earlier. Now it has become very easy to do it on your mobile or laptop all the time. Some people are addicted to shopping, and some people are addicted to pornography, and that causes its own problems. Now, what are the consequences of excessive internet usage? This will tell us why we should think of detox. So one of the consequences is time. We all have limited time, 24 hours a day, out of which we need to sleep for 7 to 8 hours. Then we need to do our day job. And then there will be just 2 hours, 3 hours to do whatever we want to do extra. Now that time is taken by internet. Not only that, internet is now taking over the time reserved for sleep, time reserved for other activities. So one of the major problem with internet addiction or excessive internet usage is we lose real time. And we have, all of us have limited time per day, fixed time, and we can't afford to lose a lot of time, but we continue to lose a lot of time. So this is one of the major problems. With many youngsters, I tell them nothing wrong in using. Can we mute, ma'am? Nothing wrong in using, but time is lost, which can be used for other things. The second thing is distraction. All these apps are weapons of mass distraction, which come in the way of your routine, come in the way of your family interaction, come in the way of your work, and the attention span. I was referring to the reels and shorts, which are one minute or lesser, and these can cause a lot of disruption to our attention span. Now, children's attention span is becoming lesser and lesser because nobody reads any book. Anything which requires attention will improve your attention span. Anything which does not require attention will decrease. So now what is happening is, if you have a YouTube video of 10 minutes, nobody wants to watch. After 60 minutes, 60 seconds or 30 seconds, there is a drop. So initially I thought, oh my God, why is there a drop? Is my video not good enough? But YouTube says that's completely normal. Only after 30 seconds, if there is a drop, and then whoever stays on, stays on. Most people cannot watch a video beyond 30 seconds because that's the kind of attention span people are having, and our social media reels and shorts are contributing to it. Another major consequence is social comparison. Your friends on Facebook or Instagram are posting pictures of their vacation, their achievements, and it's all carefully curated. We post only the positive things. We don't post our day-to-day problems of everyday life. We put in only the peak. And a person seeing this immediately compares them unconsciously and feels like I'm not good enough. I'm not up to there, and this can lead to a lot of anxiety and depression. This is documented many places that social media can lead to anxiety because of social comparison. Another problem is interference with work. Students, typically when they are studying, they have their mobile nearby, they're watching it. And if you are studying for a 3-hour period, and if you are constantly watching your social media feed, your concentration is fragmented so much that at the end, your recall of whatever you read is very low. So for students, we say if you're studying, study for 2 hours, then you take a break and do your social media, not during. But they feel they can multitask. Multitask is a myth. None of us can multitask. We can concentrate on only one thing. There are students who watch TV, TV is going on, their mobile is on, and they are also doing some homework, which is like interferes with your work and it's not fruitful at all. You do not retain anything. And even adults who work with the social media on, there is whatever work can be done in 2 hours, they might take 4 hours to finish because they are constantly bombarded with this interference from your social media feeds. Effect on sleep. If Sleeping Beauty was there now, this is what would have happened. She wouldn't have slept for 100 years. She would have slept only for a few hours. Now, many of us are compromising on sleep because night, when you have finished your day, you're relaxed, and that's a time we think we'll see it for 10 minutes, 15 minutes, end up seeing for 1 or 2 hours. And this can cause a lot of problems because if you see the sleep cycle, initially you have this deep sleep, this 3 and 4 stages, stage 1, 2, 3, 4. This is from your EEG you can make out. These are deep sleeps. The yellow one is the REM when you dream. And all of you know dreaming is very important for your creativity. And REM is very less in the beginning. Only towards the end, after 6 hours, the REM is quite a lot. So what happens is if you're sleeping for only 5 hours because you went to sleep very late, your REM is going to be very less. And that can affect our creativity the next day. And one more thing I wanted to point out, there are a lot of things about internet and sleep, but I just want to point out one thing. This is the melatonin level. Melatonin aids sleep, and melatonin level increases when the ambient light goes down. So typically after 6 p.m., those days I'm talking about, the melatonin level will go up. And then as the day happens, the melatonin level will come down. Now what is happening is our screen, when we see, the light goes through the visual pathway and goes to the occipital cortex here. So it crosses over in a place called chiasma. Chiasma is a bridge, crossover. And above that, there is a nucleus called suprachiasmatic nucleus. And this suprachiasmatic nucleus senses the light, sends a signal to the pineal gland to produce melatonin once the light goes down. Now, when the light comes back, it stops the pineal gland from producing melatonin, which will aid sleep. Now, what is happening is when we are using internet or mobile, the blue light in the mobile will make our brain or melatonin, the pineal gland, think that it is still daytime and it will not produce melatonin. So if you are on your phone till 1 o'clock and then try to sleep, you are going to take a long time because the melatonin secretion will also take more time. So that's one point I wanted to point out in sleep. And if you're not sleeping enough, there's a difference between insomnia and sleep deprivation. Insomnia is you have given yourself enough opportunity to sleep, but you're not able to get sleep for various reasons. Sleep deprivation is you can actually sleep well, but you don't give yourself opportunity because you are either on the phone or doing something else. And sleep deprivation has effects on multiple things like cognitive function, immune function, appetite, skin changes, mood, heart health, and all. So this is maybe for another day. But sleep deprivation due to mobile phone, any use, but mobile phone usage is causing a lot of psychosomatic problems these days. Now we will see the effect on family. Many times you would have seen in parks scenes like this where the parent is completely involved in the internet and the children are left. I'll just quickly go through some of the effects. Like this is a romantic couple affected by cell phone, mobile phone, and this is they get married. And after marriage, both of them immersed in their own cell phones. And this is how they talk. They talk while they are engaging in their mobile phone. You must have seen nowadays people come together, 8 people come to the restaurant, and there is absolute silence because they have all ordered and they are all on their mobile until the food comes. And then when the food comes, everybody takes a photograph, posts on the social media, again silence. Because why did they all come, plan and meet in a restaurant if they're not even going to talk to each other? Now, yeah, here, this is another thing that can happen. And many times childcare comes down because parents are busy looking at the mobile, either at home or when they are outside. These are all real photographs. You must have also seen many, many instances of parents doing this in public places. This is a classic photo, old one, visiting grandma, where all of them went to visit, but they're all on their own mobile phones. And children don't listen, they follow whatever you're doing. Now, there is a saying, don't worry, your children don't listen to you, but worry, they are looking up, they are observing you, because whatever adults do, children also do. So if adults are all immersed in their own phone, children are going to be immersed in their phone. Earlier, we told children no phone, no internet, eyes, it will bad for the eyes, but corona epidemic changed all that because classes were all online, and while attending it, children slowly get bored and change it to games, change it to social media, and now they're having difficulty coming off screen after the COVID thing was over. Now they demand screen time. This is somebody who died and continued to have a grip on his mobile phone, and this is what happened after they reach heaven also. And he says, actually, you had a pretty good life, but you're looking down on your phone and you missed it completely. So these are some of the consequences. We looked at how it interferes with work, how it interferes with family. Let me just tell one thing about the family. There was this parent who was telling, many of you, I don't know whether you have experienced, you go to a child's culturals or a sport event, and at the most important time when the child is performing, the child is performed and the child is looking at the parents, and the parents unfortunately are just, that time they had some buzz and they picked up the phone and they're looking at it. They missed the most important moment on the stage or on the playing ground, which many children feel very, very hurt that when the crucial moment, my parent was not seeing me. So it interferes with family life. And while in the house, families are in the house, but parents say, don't disturb me. I'm working, I'm on a call. And they are constantly, and they know their children know they are also on social media on and off because they keep laughing. And children feel neglected. So that's another effect that is there. And children learn what parents do. The children also start using it, looking at the parents. Now let us go to what can we do to, I think I've convinced you that there is internet addiction and there are consequences. There are many consequences. I just touched upon some of them only. How do we manage this digital engagement? One of the things I would suggest, like, let us start very small. One is awareness. Being aware. I don't know why that is not there. One second. I think that slide is not there. First one is awareness. Being aware, I am using a lot. Many people deny, many adolescents deny, children deny, because if you are doing something very interesting, you will not know the passage of time. Like Einstein said about theory of relativity. If you are talking to your girlfriend, 5 hours will look like 5 minutes. If you're talking to your grandmother, 5 hours will look like 5 minutes. So when they play games, they are not aware. So I tell them to keep a log. And nowadays, there are monitors on your mobile. If you're using an iPhone, there is something called screen time, where you can go and have a look at which screen, what are the apps you used, how long. And if you're an Android, you can go down to, there's something called digital wellness as part of Android itself. And there you can see what apps you used, how many hours or how many minutes a day. And there is another way of looking at it is how many times did you go today? Like, did you go to your WhatsApp 40 times, 50 times? Now, based on this, they have estimated that most of the adults are spending something like 4 to 7 hours on their apps. Like, this is, I'm talking about not just work, this is entertainment, most of the time for entertainment. But nowadays, since we also do work on the apps, I think there should be a way of differentiating how much of it is work, how much of it is just internet entertainment, catching up with friends and all. So awareness is the first thing. So once you are aware, one of the things you can do is disable notifications, like silent all notifications. You don't need, because social media, you keep getting buzz constantly. There are ways of going, whether you use a laptop or whether you are using a phone, you can go there and disable all notifications so that you don't get any. Many times when you go to a news site, it says it needs permission to push notification. Please say no, because otherwise, while you're working, some news will keep coming from that news media. So say no to all notification, or then there can be places where you go to the control settings and can disable notification from all the apps. We don't need it. When we have time, we are going to go to individual apps to see what has happened. We don't need constant reminder, this is waiting for you, this is waiting for you. So please remove all notifications so that you're not disturbed. Set limits on usage. Like, we can decide that I'm going to use only for this much time, whatever social media which you are used to. And you can actually set it on the digital well-being or the screen time apps on that option in iOS and Android, or you can use it on your own. You can sort of keep an alarm and say, I'm going to stop in 15 minutes or half an hour. For students, especially for children, I always tell them, negotiate with parents as to how much time is allowed, have a house rule, and stick to that. And I tell the students, you have to set the limit and monitor the limit. If parents say it's already half an hour, stop, children get upset. So I say, children, they need to sort of, first thing I tell them is monitor usage. I'm not even telling them to cut down, set limits. Monitor usage, that itself will bring an awareness. I'm using for 7 hours, 8 hours, I need to cut down. Then setting limits, stopping notifications, and then setting limits and implementing themselves. Children will have to do it themselves. Adolescents will have to do it themselves so that they are able to, and with time, they will be slowly be able to cut down. Initially, if they're not drastically able to cut down, that's fine. At least let them cut down by half an hour compared to the current usage and keep cutting down subsequently. Then house rules, they can have gadget-free zones like dining table, don't bring phones to the dining table, or don't bring phones to the bedroom. Especially for children, there can be rules. Phones should be charged outside, or phones should be kept somewhere else. Otherwise, children are awake most of the night watching mobile. So there has to be some house rule that there has to be gadget-free time. After this time, Wi-Fi will be put off. There won't be Wi-Fi in the house. So some rules like that has to be there. But the problem nowadays is children are more tech savvy. They know how to set the Wi-Fi and all that than parents. But if parents can negotiate with children, can have the gadget-free time, gadget-free day, gadget-free zone, that's a small departure from usual. That's something you can do. Another thing is, if you're working on a project, if you have to concentrate for 2-3 hours, best thing is put your phone on aeroplane mode. But many people panic. How can I not be in communication with people? I tell students, please tell your friends 7 to 9, I'm not available. After 9, I'll be online for half an hour. That's the time I can communicate with you. So that's something which students can do. Parents can inculcate that when you're working, when you're studying, first of all, don't have your mobile with you. But if you have to put it in aeroplane mode. Very difficult initially, but once they find the advantages, they'll be able to do it. There are alternatives outside the phone. Now, most of us, this audience, know because we are all digital immigrants. We were born in a non-digital world, then we immigrated to the digital world, whereas our children are born into the digital world. They are digital natives. For them, they will not think of a world without mobile, whereas we know how it is. So I would suggest there are a lot of alternatives like reading a book, which increases your concentration. There are a lot of advantages there. Exercise is cut down because you need 24 hours, and if mobile is taking away 5 hours, you are eating into other things like even exercise. So exercise is something which we need to teach children and also ourselves, so that there's a lot of joy. You have dopamine bumps even with exercise, and that's something which is good for your mental health and physical health. Maybe exercise we can discuss in detail on another day. the benefits of exercise for mental health. We could discuss another day. That's something which we could do. Being in nature, go out of the town, go to some place nearby, 10 kilometers away, 5 kilometers away, beautiful places, look at them. Because nowadays, when people go to beautiful places, first thing they do is take photographs immediately, post it, real time. That again takes away the joy of being there. I would say for people, first 10 minutes at least, enjoy without taking your phone out. Enjoy nature. And then if you want to share your joy, fine, you take your photo. But if you're looking at the world through your phone, then you lose out on the real joy of being there. So being in nature as many times as possible also is a major mood boost and also is an alternative for internet. Then real social interactions. Nowadays, people feel they're all connected because they are talking to 1,000 friends on Facebook or Instagram, but they're not real friends. Whereas you feel disconnected because it's all happening on the. If your friends on social media are your real life friend, then that's okay because you're using social media as one more way of communicating. But if your friends are only on social media, not in real life, that's a problem. So I would suggest we can substitute phones with real social interaction with friends or with family. And when we are with family and friends, I think we should put the phone in silent mode or aeroplane mode and interact. That gives a lot of joy. We need to, there is a running joke that the power went off when the Chennai floods happened. There was a joke saying, the power went off. I went down and talked to my parents. They seem like good people because this person has not been interacting at all so long. So real social interaction is another substitute for it. So with that, this is a very brief few tips. I'll stop here and I'll be glad to take questions.
Doctor, would you take questions in the chat or?
No. In real time by talking.
Okay. Yes, please.
And let me thank Eklavya Foundation once again for this wonderful opportunity. And I had a bird's eye only, not in detail because half an hour and we can spend more time on questions. Yeah.
Doctor, you've given us some cutting edge technological techniques. It's a bit of a tongue twister, but there you have it. That was very good. Earlier there was a question on the chat box about how to convey this in a manner which others can relate to it. Essentially, children. I have a question. Do you have older people also coming with such issues?
Yes. Yeah. Children, students, but even adults come and talk about their own issues. They spend a lot of time. Compromise sleep and they are on the mobile till 4 o'clock, 5 o'clock in the morning. Adults, they come themselves and tell.
Doctor, I have one question. Even though if we are not looking at phone for the entertainment purpose, even though we are looking for on our computer screen, but when we go to sleep, we cannot sleep for some time because of the mind is not calm or ready to sleep. So what can be done in this situation? If you work for longer hours.
I'm using this so that there is no echo. Yeah, ma'am, you can go ahead.
Yeah. So when somebody works for a longer hour, then it is very hard to fall asleep on time, even though you're on your bed.
I couldn't hear. 1 second. Yeah. Ma'am, go ahead.
Manjari's question was that we are engaged in work and how to essentially taper off and go into a sleep mode from the active mode.
Doctor, you're on mute.
Doctor, you're on mute.
Yeah. I would suggest very, very difficult to implement, but at least an hour or two before our planned sleep hour, it's better we are off screens. That helps our sleep, but we many times before sleeping, I take the WhatsApp to see whether there's any distress message from a patient and end up spending more time than just screening whether any patient has sent message. So that's a weakness all of us have. But if we can bring in a discipline where before sleeping, I'll pick up a book and read, because one reason is, can we mute? One reason is a book is written about one topic in detail. Whereas in WhatsApp, there are discrete messages. You jump from one topic to another that will be exciting your brain, fragmenting your brain. Whereas a book is continuously written about the same topic. So that helps. And also book is not like in a dim light or a red light. A book also will make you go to sleep easily. So if we can bring in a habit where we sort of at least the last 1 hour, if we can switch to a book, difficult, but I think we should be able to do that with conscious effort.
Okay. Thank you, doctor.
Dr. Sab,
Yes.
can we work on good things for 12 hours on the app WhatsApp?
Yes. See, nowadays, lot of people are working also on like groups. Marketing people have WhatsApp groups, administrators have WhatsApp group. All these WhatsApp is used for a lot of work. So that can be done. But night, I would suggest you can shift to, instead of blue light, there is a warm light setting. Most phones, you have a warm light setting, so you could change that if you're using towards the end, so that the light is not too bright. Or you can use a black background. The theme can be dark theme. So that will help your eyes.
Thank you.
Like for example, this is a dark theme, like it'll all be black. So the light will be very less. Yeah. Any other questions?
Regarding the pineal gland,
Yeah.
okay, in one of the books I had read earlier, they had suggested gradually turning off the light, mimicking twilight, basically going from sunrise to sunset and then tapering it away. In fact, there are some devices I understand which, when taper your light away, the ambient light away. Is it okay if we just go from direct on to off, or is it better to grade it down slowly? Because I was just wondering about this.
On your mobile, is it?
To gradually cut off the light or immediately cut off the light?
Immediately also is fine. Immediately also no problem. Sun goes down, no, suddenly it dims and goes down. But that's why I said reading. Reading a book, the light reflected on your eyes much less compared to a screen sending light to your eyes.
You had touched upon mobile usage. What about apps like Netflix and there's a lot of binge watching which goes on.
Yes.
From episode to episode,
Yeah.
they just keep watching and goes late into the night. This is an experience.
Yeah. Couple of problems. One is sleep deprivation, because it's so interesting, and they will always leave end of an episode in a cliffhanger so that you want to know what happened. So these programs are made to make you addicted. So what happens? You end up watching till 3, 4, but morning you need to get up and go. So sleep is deprived, and that can affect your next day's performance. So that's one. Second is your brain also gets fragmented too much. Like it is like, see, food is good, but then this high calorie junk food is not going to be. So that way, I would say Netflix movie is much better than this shorts, reels and all, because they are like very short and fragmented. So at least Netflix is one big story long. So, but only thing is sleep deprivation is an issue there, and binge watching, you lose, you don't like, you watch an episode, you think about it, you process. That's the way to go. But if you're watching continuously, some people binge watch movies, 4 movies, different kind of movies together, which is not, you won't be able to savor it in your mind. You will not be able to enjoy it. So that's the one on Netflix. There is a lot of screen time on your eyes, those effects. So as long as you limit it, it's okay. But they keep it in such a way you get hooked on. Like for example, Facebook or Instagram, they make it in such a way that you get hooked on, and any product which is free, you are the product. Because they take your attention, they want your attention, they keep your attention, and then get as much data from you, and that data is sold.
We have a
Dr.
question on the chat box about Kindle. How does Kindle compare? I think to
Yeah, see, book is any day better, but Kindle is much more easier. You get it immediately. The cost is low. And there are a lot of advantages to Kindle. You can store any number of books. So it's handy. But the screen is the only problem. But I think nowadays we are getting used to Kindle, reading a lot of document online. But a book is a book any day. Having said that, I also use Kindle on the laptop. I don't have a Kindle device, but on the laptop, I read Kindle documents. So it's a sign of times.
so probably there is a dark mode in Kindle also, and
Yeah, there are.
there are dark modes in Kindle.
Yeah.
So I have a question. As I'm also patient with a person with lived experience. Uh, I just want to make an observation that if I'm engaged in a movie which is intense for too long, it really affects the way I interact following the movie for at least 15 minutes to half an hour. Is there anything you'd suggest to come out of one frame of mind, like watching and binge watching, and coming to a relaxed frame of mind? Is there any gradual steps which we can use to come back to comfort levels?
I would say if you are disturbed, feel vulnerable after a movie,
आज जाते हैं मीटिंग होती
doesn't matter. It's normal. Feeling vulnerable or feeling emotional after a movie, that's the success of the writer and the director and the artist involved. So nothing wrong in feeling your emotions are altered. That's fine. And slowly you become normal after some time. You come back to your baseline, but that's completely normal. There's no technique needed to immediately come back because a movie will move you emotionally. Any movie is like, in fact, the genre of a movie is about emotions. Like horror is to make you feel anxious and terrified, panic. And adventure is to give you thrill. Uh, Tragedy is to make you cry. So comedy is to make you laugh. So most of the genre is about emotion. So if they change your emotions, that's the success of the writer and the director. You don't have to immediately switch back to your baseline.
Thank you, doctor. We have a question: is there any medication which can be given to prevent? And I think that's a question which is coming to my mind, but then
In fact, one of the recent conference, my topic was on behavioral addiction. This is predominantly work is on gambling, but also on internet addiction. But they have tried certain medicines, but plus minus, they are equivocal research. In practice, sometimes we use something called NAC, N-acetylcysteine. That is something which we have used, which gives you some amount of effect. Then naltrexone. So these are the two things which you have tried. NAC gives some benefits. But then most important is the person's motivation to stay away rather than medicines. The person wants to stay away, then many of the behavioral techniques, there are a lot of behavioral techniques, but the problem is if a person is not motivated, I can't even tell them these are the behavioral techniques they can try. There was a question on podcasts. I didn't read the full thing. Did you have a look, Ganesh?
Yes.
I missed that.
What,
Manjari.
That's me.
what about
I'm Rohan.
yes,
I was asking, I tend to like to listen to podcasts before I sleep. So I switch off my phone. I implement many of the suggestions that you've given earlier, which is like put on DND mode and only allow immediate family to reach you in case of an emergency. But I like to listen to podcasts while I fall asleep. So I'd like to know what your suggestion is when it comes to audio versus visual.
Yeah. See, audio is an excellent method because podcasts are excellent because you can actually do two things. You can walk. Video, we suggest don't do two things. All the major accidents in our country, elsewhere, are all due to texting, due to driving and texting, watching video while driving. So audio is the best thing when you are on a car driving or a co-passenger. You can listen to podcast.
I'm talking specifically about before sleeping.
Okay. Before sleeping also, podcast is a good idea, provided you have kept the timer and all. And podcast is good even at other times, like if you're cooking, you're doing some other work. Podcast is a great way of getting information or whatever your topic of interest is. It doesn't involve your eye, so those eye problems are not there. So
So do you
podcast
have
is
a podcast that we can listen to?
I should convert all my videos to podcast. I should. Yeah, not yet. I should change all my videos. I consume YouTube also like podcast. Sometimes I in the car I put it on like TED Talks. I don't see it. I keep it on the seat nearby, but that's not a good idea. Because suddenly, if there is something, you have a tendency to see the screen. I think audio is the best because there's no urge to see the screen.
Right. Doctor, does this headphone hurts us in any other way if we put it on a longer time?
If the volume is low, not a problem. If the volume is high, yes, it can affect.
Okay.
And
Hello?
no Zoom meetings while driving. Because I did once. I did once and paid the price. My turn was very less. Initially, others were talking. It was a meeting to decide something. So I had it in my car and I was driving. And I was also watching on and off. At one point in a curve, I went out of the road. So I had to get people to that. Meanwhile, my turn came. So I just went near a tree and I gave my talk, and people would have thought, oh, the background looks so real. It looks like a real tree. The leaves are all. So they would have wondered, how did I manage that background where the leaves are all moving real time? But they didn't know there was a car down and I had to finish my talk, then get people to get the car out. So I would suggest no kind of engagement while you're driving.
Hello,
Yeah, yes, sir.
sir. I'm trying to avoid the social media, but I'm trying, but not it is actually happening. Hence, I know it is bad, but I use it, and after using it, I feel guilty that my time is lost, my time is wasted. So I think that the next time I will do improve, but then again it comes
Yeah.
to original state. So how can I control it? What can I do?
We talked about few things, no, sir. First, you
Okay.
see how much time you're using, then sort of plan, okay, if I'm using 5 hours, I'm going to make it 4 hours. Or if it's 4 hours, I'm making 3 hours. So you can sort of set a limit and then try to limit that and do other things meanwhile. Or if you're working on something else, put it on aeroplane mode. So you can use these, first of all, once you realize I'm using this much time, actual time, we know a lot of time, but when we know the real time, then we can plan, okay, I need to lessen it. So start from there, start from measuring the time you're spending. Like you can have it both in digital well-being on Android and also iPhone. It's called screen time. Earlier, it used to be a separate app. Now it's part of Android itself.
Okay, sir. Thank you.
Yeah.
Do we have any other questions? We've come to the end.
You have looked through the chat questions.
Manjari,
Yes, I'm looking at it. I think we have covered everything.
That's wonderful.
Yeah.
So, Doctor, thank you very much for
Sure.
being with us today. And I know you have some engagement and you've managed to.
Is it possible? Is it possible to share? Is it possible to share the PDF? PowerPoint. It is a very good.
Yeah,
Yes,
I'll send
yes.
a PDF. I'll send a PDF. I've sent the backup to Ganesh, but I'll send a PDF.
Information.
Yeah.
I
Ganesh, I'll send you a PDF. You can distribute.
Sure. Thank you, sir.
Yes,
It
yes.
was a very nice session, sir. It was
Yeah, thank you,
over.
thank you,
It
thank
is
you,
a very nice
Well,
Thank you,
session.
thank you,
Very
sir.
informative.
Thank you, sir.
thank you so much once again, Doctor. And
Thank
we'll catch up again.
Yeah.
I hope we make it a hat trick. So, one,
Yeah,
two,
we could probably not now. I think I should not come and bore you. Maybe 3 months, 4 months later, we could have exercise and mental health.
all right, sir.
later.
Thank
Yeah.
you very much.
Bye
Everybody,
bye.
thank
See
you
you.
very much for being
Thank you.
participating
Thank
in.
you.
Thank you. Thank you.
Bye
Have a
bye.
good
Bye bye.
Well, thank you. Bye.
Bye bye. See you.
New money.